the end, and we'll send you the slides.
Did Heidi just drop from the call?
It does look like we lost her.
Okay.
I'm not sure what happened there.
I just texted her because I don't know if she may be just doing her presentation and not aware that she's not on.
Yes.
Can you see her in the waiting room?
No, she's not in there right now.
Yeah, for anyone just joining, we're just waiting for Heidi to log back in. I think she got booted somehow.
Yay. Wonderful. Okay. So just great to be here, everyone. Sorry for that little technical glitch. We'll just go get started since we just lost a few minutes. So you can go ahead and that's our contact info, and Ikra will send you the slides. So we're just going to start off with what do you find at a Young Adult Access Center? Just curious to know if folks can say in the chat if you have visited a Young Adult Access Center or if you've worked with one of our programs. Just shout it out. And so for those of you that haven't, Anna and I are going to paint a picture for you. These are the programs that, we work with and we support out of central office. And Ian in particular works with the YouForward program in Everett. So I'm going to sort of share photos and descriptions, and Ian is also going to fill it in with, as someone who works in a Young Adult Access Center every day, some of the things that he sees and experiences. So, okay, great. People have visited Lawrence. Access Center is a dynamic community that creates a culture of belonging, refuge, and opportunities for growth. Also, as you see, there are amenities to support basic needs. So you see the laundry, the kitchen, there are computers. Ian, what does this look like in an everyday basis?
Well, we have people who come for drop-in. It's anyone between the ages of 16 to 26. It's a low barrier access to services, so it's very easy for young adults to just come and go at whatever times work for them, as long as they're within our drop-in hours, which are in Everett, it's 1 to 7 on Mondays, and then 1 to 5 Tuesdays through Thursdays. Like Heidi was saying, we have a washer and dryer, a kitchen, food pantry, resources board, art room, music studio at the Lawrence Center. We have a quiet room, clothes, toiletries, any kind of essentials we can give out to young adults. We also have like a lounge area that has games where they can play like video games and connect socially. And also, we have tip facilitators there who can help connect the young adults with any kind of needs they have or resources they're trying to get connected with.
Great. Yeah, I mean, the other piece of this, and we'll continue to sort of show you snapshots, is, as Ian is saying, generally mostly staffed by young adult peer mentors, but also tip facilitators that can help support young adults' goals, specifically through an evidence-based practice. So we'll go to the next slide. So one of the evidence-supported interventions is TIP. That's the transition to independence process. It's really about, empowering young adults to, explore what their goals are, their chosen path. This is by their choice at their own pace. The other piece of this is, young adults have expedited pathways to community supports and services. So one thing I should say is that our programs don't require diagnosis. There's not a lot of paperwork. It is a low barrier environment. However, most of our young adults are experiencing either mental health challenge, substance use challenge, whether or not they're diagnosed, and other trauma systems experience. So I think that one of the pieces here, once they gain trust with the team at the Young Adult Access Centers, if they need a higher level of care, they are more likely to engage than if they were going to that resource directly. So whether it's DMH or DDS or treatment, substance use treatment. So I don't know, Ian, if you can share anything about what that looks like.
Sure. I mean, one of the first things we or the peer mentors or tip facilitators will do is try to like build rapport with the young adult and find out what their interests and their needs are. And we have like a resource board, and we also have a lot of community collaborations or a lot of services we work with. Like we work with CHA, Mass Rehab, the Phoenix, YMCA, City of Everett, local high schools, gift program, NAN projects, and a lot of other services that are good for young adults. It would take a while to list. And like Heidi was saying, we all the like events and program or groups we implement in the program are based on what the young adults ask for. So we have like a youth council every month where the young adults will give their feedback on like what events or resources they'd like to see added. So it is, yeah.
Yeah. A lot of leadership opportunities. So participants really help to make the program effective for their peers. So they might co-lead groups, organize events. So I think that's really an important piece as well. Okay, next slide. I just thought you might like to see some of these photos if you hadn't been to a center before. So trying to bring it to life for you. But so young adult peer mentors with lived experience are the backbone of these services. They have a really strong connection with the participants. They share their lived experience with purpose and intent in a way that really helps young adults connect. They may have participated in one of two trainings or both. So we have a young adult peer mentor training specifically for this group of people that are in this service. but many are also a certified peer specialist. I saw that we had a chat from a CPS. And I think one of the things we have learned is that they are one of the key points of engagement for young adults in the centers, but also gaining trust for young adults that might need higher level of supports to be able to reach those supports. So I don't know, Ian was a peer mentor, now is promoted to a coordinator, but any story you want to share about peer mentors?
Yeah, I would say, I mean, I can give an example, of like one young adult, we had, who was struggling with having intrusive thoughts and struggling with isolation, and our peer mentors like talked with her and kind of found this out. And they used their lived experience to help like connect and build trust and rapport with her. We helped supported her with getting transportation to come to the center more to like get more social engagement. And we also helped get her connected with a therapist, and eventually we did help her get into school, and she was able to finish a degree program and is now actually working as a peer mentor, and has worked with the NAN project as well. She went to events for a while and she made a lot more friends, so she feels more socially connected. So that's just like one example of like how we can help young adults.
That's a great example. Thanks, Ian. I mean, I think the other piece about peer mentors and these centers in general is that they inspire hope in a lot of young adults that have been socially isolated and not participating in the community. That's a great example, Ian. Okay, next slide. So I just wanted to share with you the map of the centers. We would love to open more. We would love to have them available to every young adult in the state. We're not there yet. We have developed centers under many of them under SAMHSA grants. We are still looking at a path toward sustainability and fully being funded under state funds. So definitely, if you have thoughts about how we can get to that place, we would love to hear them. But we are excited to see how quickly they've expanded, especially in that the first center opened in 2016, and that was 1, and now we have 10. So pretty excited about that. Okay. Next slide. So, and also in terms of engagement, the increases we've seen, we prior to 2020 only collected data from the SAMHSA grant funded centers. And then we began to collect data from all 10 centers, as you can see in this chart, in about 2022, 2023. But you can see the growth, right? So we had about 4 centers with about 176 participants in 2020, and 10 centers with almost 1,300 participants in 2023. We've really been excited to see that growth. So, okay, next slide. And young adults come back a lot to engage in the services. There's no obligation for them to do that. I mean, they can come once, they can come every week, they can come every day they're open. But what we found is an average of 10 visits at each center. So that puts us at 13,000 engagements. And that was in 2023, and it's even more at this point. Really strong on diversity, it both in terms of race and ethnicity, and we can go to the next one. And trans identity and LGBT identity. Ian, do you want to share what centers do to make folks feel that the space is welcoming and supportive of whatever identity that they bring?
Sure. I mean, one of the biggest components of our centers is that they're inclusive and a safe environment for everyone. And part of We don't have like a very long registration to join the program, but like one of the documents people have to sign is a mutual respect policy, basically agreeing that everyone's going to be respectful of each other's identities. And we do have an extremely diverse group of young adults who come, and they all seem to like get along. We really haven't had any issues as far as like anyone feeling discriminated against. The young adults have been very respectful of each other in my experience.
And I think the staff really reinforces that culture and that sense of community. And, you know, I hear examples of, you know, a young adult organized for the Access Center to attend the LGBTQ Pride March in Boston. It wasn't just the LGBTQ youth that attended. There was a really diverse group of youth that were there. So whether identifying or as allies, and I think that's a really strong piece of this work. So, okay, next slide. So more about the profile of who participates. This is part of our data collection. I will definitely give a shout out to UMass Medical School for health consulting, which helps us with this. We enter data for young adults into their REDCap system. These young adults aren't necessarily enrolled in DMH, so we have a separate data tracking system, which has led us to getting not just basic data, but also some important outcomes, which I'll also share. But just so you know, like, what's the profile of these young adults? Majority are unemployed. A good number are not enrolled in school. 35% are currently using substances. Many have no source of income, no form of ID. We see a lot of young adults who utilize our services who might not even be documented, and they need some support around how to navigate. And I think that our centers bring a lot to that process as well. Many are living in an insecure situation or experiencing homelessness. Okay, next slide. Okay, so just who engages the young adults, as Ian and I were saying, the majority is the young adult peer mentor. Transition facilitator is the person who implements TIP. Not every young adult has to or does participate in TIP. Sometimes it's the supervisor. We do have a pilot of recovery navigators that are funded by Department of Public Health. And so we do also some recovery work, and that, you know, that's shown some promising engagement with young adults who otherwise were not seeking treatment. And we have some centers have education and employment specialists, outreach and engagement. And I would say outreach and engagement and family partner is often geared toward families to say, this is a space that could really support your young adult child who's struggling. So, okay, next. So right now we're actually working on a toolkit that really begins with our core principles. And that toolkit is really going to support centers in implementation, but also in helping new centers as they start up. So just to share some of the core principles that we've developed in collaboration with the Access Center teams and young adults who participate. So peer mentor staff are integral. Young adult voice is a driver. Ian mentioned the Young Adult Council. They choose and guide their participation in whatever they do or do not want to do. They respond to changing young adult culture and broader social issues. The centers, for example, that were around when we had, pandemic and lockdown, all adapted to online meetings, did a lot of gaming. They visited a lot of young adults. They brought food to them. And so whatever is kind of going on in our wider culture, the staff and the team are really aware of that. They're aware right now that many young adults along with the rest of us, feel a lot of stress, for example, about the election. Their immigration status might not feel secure. They might be LGBTQ. They're, so we know that. And I think centers are really good at supporting young adults who might be experiencing those pressures. Okay, next. And then more core principles is that services are low barrier and flexible. We really prioritize young adults who may have been excluded from services in the past or maybe felt excluded. So BIPOC, LGBTQ, and others. We have innovative practices and policies. So all of our centers are part of larger human service agencies that many of you might work in or work with. And those agencies obviously have a set of policies. One of the things we work with those agencies around is some flexibility around, say, for peer mentors and hiring practices that might involve Corey and understanding that someone who has lived experience, might have some things that are flagged when you do the Corey, but that shouldn't necessarily stop them from being effective in the role. And so that's just an example of how we work with agencies around their policies. They're also interwoven to the local community. So like the center in Chelsea just took part in the 400th anniversary or something of Chelsea, which is like unbelievable. Maybe it was 350, but it's a lot. And they had a float, and like everyone in Chelsea knows them. They're on the Spanish radio station. It's been amazing to see. And I don't know Ian Center as well, if you have any examples of how you are engaged with the community.
Oh yeah, we actually just did a tabling event in the community. We also have community network meetings where different community organizations will meet. And we work with, we've been going to the local high schools. We also spoke with local police. We work with Cambridge Health Alliance, which is right next door, or like YMCA, or the Phoenix, a lot of different community programs, or like any local food pantries or respites. We have a long list of different organizations we've referred people to.
Yeah, and a lot of the food pantries actually have opened up satellite sites in the centers. Some of the centers actually also have like clothing pantry. I don't know what the right term for it is, but they call it the closet, and it's opened to young adults. Okay, next slide. So I wanted to share like some of the promising outcomes, and I think one of the things we've been able to measure with the help from UMass is when someone first comes into the center, and obviously taking part in these interviews is optional, but most young adults do. And then, months down the road. And so here's the things that they've seen improvement on: handling daily life, having a safe space to live, social connectedness, functioning, lower frequency of negative feelings, less bothered by psychological or emotional problems, and overall mental health. I mean, I think these are really, really promising. It's what keeps us going and what keeps us believing in this model. So, okay. Actually, Ian, anything you want to say about any of these before we move forward? And what you've seen in terms of improvements?
Yeah, just that those statistics look like a good representation of the changes that I've seen young adults make. Like I have seen improvements in those areas from the young adults we've worked with. And housing is definitely one of the top things. Having a safe place to live and social connectedness is also, one of the most frequent challenges I see young adults facing. So yeah, it just looks accurate to me.
Yeah, it's great. I mean, it's very hopeful to see that on a day-to-day basis, I'm sure. So, okay, next slide. So I'm going to give it over to Ian to speak a little bit more. And I know that we've sort of been sharing some of the talking points, but as a young adult with lived experience of psychosis and working with your team, I thought it'd be really nice for Ian to share with us some of the things he's seen in the center, specifically with young adults who may be experiencing psychosis.
Yeah, so we have definitely referred some young adults to well, first of all, I would say our peer mentors and tip facilitators do a great job of using their lived experience to help connect and like build trust with the young adults. And then a lot of the challenges they face are isolation or like not having social connectedness or not having connections to like resources that can help them with their mental health challenges. And I've seen the center help a lot of young adults in that respect. Also just like kind of finding more of a purpose, like whether it's with continuing education or getting involved in something like making music or sports or any kind of community involvement that could be helpful for them. But I also think it's key that they have feel like they have other people to talk to who are facing similar challenges. It just helps like normalize that. And also we have a lot of young adults who will have challenges with substance abuse. I've driven some young adults to for detox intakes. Or getting them into a residential program. I've also helped young adults get connected with like, say, a nutritionist or like a variety of different challenges that young adults face, especially if they're also dealing with mental health challenges. And yeah, I think also just peers being able to connect with each other is just a big benefit of this space.
Great.
Yeah.
Thanks, Ian. And wanted to ask you, Ian, specifically in that I know that you were a peer mentor in a first episode program prior to this, and you helped some young adults experiencing psychosis to engage in young adult access centers.
Yeah.
And I was wondering if you could speak to that specifically, because I think people are wondering about, is this model going to be able to support those individuals?
Yeah, I've used to work on the Peace team, which is first episode psychosis team, and I used to bring a lot of the young adults I worked with to the access centers actually when they were like first starting. And I did see how, first of all, I felt like it helped young adults to just get out of their house and get active in something. And also just to like engage with other people can be a big deal for someone who's dealing with depression and isolation and intrusive thoughts. And then they're also just more connected with people who can provide them with like coping strategies and just people who can kind of see how they're doing day to day. Like people get to know them and they can maybe identify if they're having a bad day more easily. But I just think like getting engaged in the community and becoming more active has helped a lot of the young adults I've worked with who have had psychosis.
Great. Thank you so much. And I think we are gonna just go to questions now. And Ian, again, thank you so much for partnering with me on this presentation, but Ian and I would just like to open it up to the group. So I think we could just take down the slides, if that's okay. And I don't know if there's a way we can see the group members or if this format doesn't do that. Well, we see a couple of people. We'll take what we can get. It just feels more personal if we could see everyone and they don't just see us. Okay, sweet. So yeah, so we're just going to open it up to questions and discussion, and like to hear what you've seen as well with your young adults that might be interested in utilizing the service. And I don't know if there's things in the chat that we can go to first, or Shay.
Hi,
Hi, Shay.
good morning or
Good
good
morning.
afternoon now. I was by the way, I loved everything that you guys all have to offer and everything you guys had to say. My
Thank you.
so for me, I do want to know for the Springfield Access Center, Access Center, if you guys they're maybe hiring for peer mentors.
Yeah, so every center is sort of independently run. I mean, DMH oversees the contracts. But Impact Center in Springfield is one of the busiest centers. They are often hiring. So they're run by Gandara, so you could definitely check the Gandara website.
Yeah, I
Um,
looked it up when I seen the map.
Yeah,
Mm-hmm.
it's a great, really amazing community.
Yeah,
So
because I'm
wonderful.
working. Yeah, because I'm working closely with an individual that just recently got a certificate through community college for a peer mentor. And I'm looking for opportunities for her with that. Do you know what qualifications that center needs to?
Yeah, no, I would encourage you to reach out to them directly. Christina or Carmelo, just, yeah, reach out to them directly and, even set up a time to meet with them to learn more about what they're looking for in the team. But I would say, generally, you don't have to have your peer mentor certification. We don't really have a certification. We have a core elements of peer mentoring course. And there's also CPS. You don't have to have that all set when you enter, but if she already has a community college certificate, that would definitely be a plus.
Oh, great.
People can get training and during the course of learning the position.
Awesome. Thank you
Yeah.
so much.
Great. Hassan.
Yeah, hi. Thank you for that. That was a great presentation and I learned a lot. Actually, in the process of just starting to learn about young adult access centers and how they can help the population I work with, which is now first episode. And I just wanted to ask, like, what's like the percentage of first episode people you've been receiving? Like, are they a couple months out of episode or a couple of years? Because the population I work with varies. They're anywhere between right out of an episode or having been away from it for a little while. I'm just wondering, like, how is the team equipped to handle that?
Ian, could you speak to that? I mean, each center, there's 10 of them, so I don't know that I could speak for all the centers, but maybe Ian can just share.
Sorry, I missed
what
the
he's
last
seen.
part of the question.
I guess the basic is like, what's the percentage of first episode people coming into the programs? Like, that's the main gist of it, because that's the population I work with now.
I would say maybe like 33%, maybe like 1 in 3 people, something like that. 1 in 3 or 1 in 4 people around there.
Okay, and you said they don't have to have any DMH certifications or anything like that. They can, they're mostly everyone is welcome with things.
Yeah,
like that.
anyone, but the only qualification is being between the ages of 16 to 26.
Okay, perfect. And if I think of more questions, I probably will reach out. Thank you.
Thanks. Yeah,
Sure.
definitely.
Thank you. I think too, while we're waiting for more questions, not having to have any diagnosis is a big plus for young adults. It turns out that a lot of young adults who come in who don't have a diagnosis eventually learn a lot more about themselves in the setting with other young adults and with the peers, and maybe then kind of see that they could use more and get linked to maybe the helpline, maybe the community-based mental health center, to learn more about what's kind of going on for them. But not having to have the diagnosis in the first place is really helpful because they might not be ready to go there when they first connect. So. Other questions? No, go ahead, Ian.
I was just gonna say, transportation is kind of a case-by-case basis. We do sometimes help with Ubers, especially if it's like for an event, or for a group. And we have helped people with getting tap passes, and in a couple cases we got people scooters.
Oh, cool. I didn't know about that. Yeah, and then at least one center, Brockton, has a van and they pick up young adults. They do a lot of trips. It's a very fun space. Other questions?
Hi, Heidi. Hi, Ian.
Hi, Emily.
Hi. I was curious what you were just saying about folks coming to the center and then over time kind of starting to think like, perhaps this is what's going on with me, or like kind of learning more from other folks and putting more meaning to it. Sometimes I wonder if either of you have thoughts about resources or ways that like, folks perhaps in like the early psychosis world, since that's the group that we're talking to here, but I'm sure it would apply to other areas of mental health too, could like help in that respect in any way, like providing any sort of resources or education, or having it available to folks, or if that already happens, what does that look like? Yeah, anything along those lines?
No, that's a great thought, Emily. I know that you have visited our Access Center network meeting. We meet with folks from across the state monthly. So they're familiar with Empath. I know some of them have definitely contacted Empath as a first step for finding like the right space for the young adult. But I think if they were able to see early signs, that would be really helpful for them. So we would totally be open to coordinating training for the staff. I know too that when a referral is made, let's just say the helpline, it's not just here's the phone number. Would you like me to be with you when you call? Would you like me to come with you to the CBHC for your first appointment? So I think there's that high level of engagement and partnership, which really helps to facilitate those connections. Ian, anything you want to add to that?
Sure. Also, we might have some young adults who just haven't worked with any like healthcare services, or haven't worked with them enough to like get a diagnosis, or to have a diagnosis, or really know exactly what they're dealing with. But sometimes we can help them to get that support or evaluation to determine that.
Okay.
Definitely.
That's great. Makes sense.
You mentioned some of the peer mentors or certified peer specialists. Do you know what percentage are?
I don't. We do have a report that we did, which I could pull from, but I don't know offhand. I would say, a requirement is our core elements for young adult peer mentoring, which is what the practice is based on. It kind of a lot of the young adults, especially because you're going to grow out of being a young adult peer mentor because it's sort of age based, go on to get their CPS. And so they have both, and I think that's been really, really helpful. So that also helps them to be eligible to work, across the state in adult services. I don't know, Ian, if you want to share any other specifics. Do you have a CPS?
Yes, and I know for me, you had to have one within a year of hire. I'm pretty sure that's true of all positions.
Yeah.
Okay. And one other question. I don't know if this was asked already, but I'm a CPS with a first episode program at MGH, and just curious if someone I work with wanted to come to one of these centers, would I be welcome to join them for like the first visit or something like that?
Definitely. Where are you located, Lucy?
MGH in Boston.
MGH. Okay, yeah, probably Ian's center would be fairly close. That's Everett. There's one in Chelsea, also in Roxbury. And so I think does my slides have the link to all of the centers in one of the slides I didn't share it. If not, I can send it right now. So you can get in touch with them directly.
I was just gonna say young adults often do come in with the person working with them.
Thanks.
I'm just looking to put that in the chat. I'm sharing with you Speaking of Hope, which is a website that we have that's geared towards sharing information on young adult mental health and resources, and it has links to each on all the centers.
Hi, Heidi and Ian. Unfortunately, I had to sort of drop off for a couple of minutes, but so I didn't know if this was already covered. But I know you had mentioned earlier in the presentation that sort of some of the access centers have employment and education specialists, and I guess I was just kind of interested in hearing more about those positions and if those were sort of funded through a specific
Yeah,
grant or or sort of, and then kind of what happens around employment and education in those centers that don't have that staff position.
right. I mean, generally, almost all the centers either have a TIP facilitator or a transition facilitator, and it's basically the same thing, but we're trying to get everyone trained in TIP, and they're not called a TIP facilitator until they finish the training. And so that is the evidence-based practice that is most effective with young adults. There are centers, I believe in Gandara Center in Springfield, that got a grant for employment and education. It actually came through BSAS, DPH. And so other centers have gone for other sources of funding to enhance their staffing. So that's just one example. I know every center would love to have that position.
And
So.
you know, the Lawrence Center has a housing specialist. I'm not sure if they get separate funding for that, but I was just also gonna say our peer mentors and TIP facilitators are like very familiar, at least they're used to helping people with housing. It's like something they have to do a lot. And continuing education. We've definitely helped some people. They've definitely helped some people attain housing or fill out lots of applications for housing and get into school. We've had a lot of young adults get into school actually, especially recently.
Yeah, for
Especially where
sure.
community college is free now.
I know when when I had visited the Lawrence Center, and this was a long time ago, I know they were sort of across the hall from our clubhouse in Lawrence. So I guess I was interested in any other kind of relationships between access centers and clubhouses, and if particularly as young adults age, is there sort of like reciprocity but between clubs and access centers, or
Yeah, I think it varies by center. I mean, I know because they're co-located that the Lawrence YouForward and I'm trying to remember the name of the clubhouse. It's across the hall.
Point After.
Point After Club. They have a strong connection. They collaborate on a lot of things. They actually, because Point After Club has that like huge industrial kitchen and they do cooking things together. I've heard that some of the young adults have helped Point After Club folks with technology because they were more fluent, and the clubhouse has invited young adults over there for some of their programs. So I know that's a strong one. I don't know how strong it is in other places. We do try to encourage that, as when you're not a young adult anymore, you kind of have to find a different program, and we definitely encourage people to make that referral. I know there's also a pretty close collaboration at most centers with Mass Rehab, especially they have the grant that focuses on STEM for young adults. And so I think that has been a stronger connection than any when it comes to the employment piece.
I don't want to take up all of the time. I had one more question,
We have plenty of time.
but I can pause if other people have questions too. Okay.
Go for it, Michael.
In I guess in one of the also one of your slides, I know you were providing sort of a breakdown of kind of demographics of Access Center participants, and I was, you know, and I think it said like 49% Hispanic, or it was, you know, like it was it was a very significant number. So I guess I was interested in language access services, which is, you know, something that I think we're all, or at least on the adult side, we're continuously struggling with and trying to figure out. Could you say a little bit just about sort of language access?
Definitely. So I'm just going to give you a warning. My dog might start barking. There are roofers putting ladders on my driveway. But yes, in terms of language access, I would say that all of the centers that have a large Latinx community have bicultural bilingual staff. And that just makes it natural. That's one of the reasons why there's so many Latino folks using the centers, because it is part of their community. You know, in Chelsea, for example, the director of the Chelsea Center, who's Latinx, out lesbian, grew up in Chelsea and has been a tremendous role model and inspiration to young adults there. And all their staff is bilingual, bicultural. And I think that's pretty true in Springfield and to a certain extent in Lawrence as well. Not everywhere, but I would say majority of centers with that population have at least some bilingual, bicultural staff. I don't know if you want to add something to that, Ian.
Yeah, no, just I guess also like Lawrence, Chelsea, and Everett are also areas with a high population of Hispanic people. I mean, that's kind of what you were saying as well, but so that might also like, I mean, we have a very diverse centers regardless, but like it might skew the statistics somewhat. But yeah, we have bilingual staff at the Lawrence Center in Chelsea.
Have those, I guess it doesn't sound like centers have had any trouble sort of kind of recruiting bilingual staff when they're needed. Yeah, okay.
I think that has to do with their relationship and engagement with the community. I mean, it's not always easy to recruit people, but I think we get there. We're pretty close. I have to look too at the data of, you know, language access in each center, because it may vary. And but I think it has to do with the engagement of people want to work there. In fact, a young adult in Chelsea who was participating in the center went to some training, was very limited English speaking, and really there was an open peer mentor position and wanted to apply for it, but wasn't sure she could because she was limited English speaking. And the organization, which is North Suffolk, really encouraged her to apply. And she has been taking English classes at the same time. And she is an amazing young adult peer mentor. And so I think that is another piece, and that she's not the only young adult who's come from being a participant to being employed at the centers. So any other questions, comments, thoughts?
Yeah, for the housing, how does that work if someone doesn't have DMH services? Like, is it, because I've worked at ACCS teams as well, and like, is it similar to a housing coordinator, or like what resources do you offer?
Right. I think every situation is unique, and sometimes there's someone who's challenged, you know, and has insecure housing situation that probably would qualify for DMH services. So we would work with them and encourage them to apply and, you know, potentially get ACCS, which would, you know, support their housing as well. But it really depends on what's going on with that young adult. For some people, you know, they could enter, the folks, primarily tip facilitators and housing coordinators would facilitate getting into public housing and other opportunities. I know Ian mentioned Lawrence has a housing coordinator, which I believe is supported by the city, and the Roxbury Center also has one that's supported by the city of Boston. And so these partnerships are what really has been helping to get young adults the housing supports that they need. It's mainly through partnerships. We don't have our own housing. It's all through helping people make those connections and navigate those connections, because how complicated it is, right? And so I think just getting that support, it makes a huge difference. And we saw in our data that their housing situations have improved since participating in the center.
Yeah, I've seen
Thank you.
several young adults attain housing since I've been here who were homeless.
That's great. Okay.
And also in the interim, they may be staying in a shelter. We know what the young adult friendly shelters are. We know what the gender friendly shelters are. We work very closely with the Unaccompanied and Homeless Youth Commission to really stay up to date on those resources. And if they're in a shelter and they need a place to go during the day, they could come to the center and do laundry, stay warm, stay cool, play video games, work on their housing applications. There's a lot that the center can offer them during the day.
Okay. That's all great to hear. Thank you.
Yes, they can just show up. They should check the hours just to make sure they're showing up when the centers are open. Most centers are 16 to 26, as Ian is saying. We have 2 centers that are on a SAMHSA grant through the SAMHSA's Children Mental Health Initiative, and those only go till 22, but the rest of them go till 26. Yeah, but they should just check the hours. And one of you can bring them, you could call ahead saying we're coming, we'd love to have a tour, just if you're wanting the young adult to see the space, but you don't need to. All right. So, Ikra, I think we're finishing. If there's not anything else.
Awesome. Well, thank you so much. It was really good and so informative. Just any final questions for anyone? And if not, then we can end here.
I'll send the slides to Ikra, and definitely feel free to reach out.
Yes, and a recording of this will be put on our website soon.
All right.
Well,
I hope I was having a
you.
good hair day then.
No, it looks great.
All right. Thanks, Ian. Nice to see you,
Thank
everybody.
you, Ian
Very
and
good.
Heidi.